When, again, there was so much negativity and so much cynicism and skepticism about whether or not, with the opposition of the White House, the leadership of the U.S. House of Representatives, whether this thing was ever going to make its way or get anywhere. But the fact is that your voice was heard, and the institution of the U.S. House of Representatives did move forward and did act. We've still got more steps to go, but people really should at least take a moment and really recognize that your input, your care, and your concern made a difference. Hi, this is Congressman Joe Courtney. I'm speaking to you from my office in the Rayburn Building at the U.S. Capitol in Washington. Yesterday, the U.S. House of Representatives passed a vote, which really I think is worth talking about for a minute because it defied all the conventional public wisdom about the fact that the Congress is hopelessly gridlocked, particularly over the issue of health care. Yesterday, we passed the Breaking the Gridlock Act, which was a bipartisan vote that, again, overcame months and months of obstruction and resistance to extending the tax credits for people on the Healthcare Access Exchange program that provides accessible and affordable health insurance. The bill, which was passed, extends those tax credits for 3 years. And it's really a really important measure for thousands of people in the state of Connecticut. The estimates are basically that about roughly 32,000 individuals and families would lose their health insurance without extending those tax credits. And over the course of the last 4 or 5 months, when I've been crisscrossing the district in eastern Connecticut, held roughly about 25 to 30 town halls, visits with patient groups, visits with medical provider groups, hospital providers, you name it, across the board. This is an issue that people were very focused on. The cost of living, obviously, for all of us in the state of Connecticut is really becoming very, very challenging. There's no question that the cost of healthcare in particular leads the way in terms of the affordability crisis that so many people are experiencing. During the course of those town halls and those visits around the district, we heard directly from individuals who had been on this program with the benefit of the tax credits, who are going to see their premiums jump from as much as $800 to $3,200 a month for a couple in their 60s. We talked to a small business in Norwich. Same thing, their family premium was going to go roughly from about $700 or $800 a month to roughly about $2,000 a month. And again, that does not include still the out-of-pocket costs for deductibles and co-payments, which these plans certainly require. It is not free health insurance, but it is at least an opportunity for people, particularly in the individual market, in the small group market, to have an avenue to get affordable, high-quality health care, which is something that, again, in terms of the calls and emails that have come into our office, we had a telephone town hall with 10,000 people across the district listening in about precisely the question of healthcare affordability. And I cite all of that external input because yesterday, again, we overcame the hurdle of the Speaker refusing to bring the bill to the floor. A discharge petition basically overrode his objections. We had to go through more procedural votes. And finally, yesterday, we had a vote on passage of the measure, which, as I said, passed 230 to 196. So this issue is still moving forward. It's still alive. The Senate has an opportunity to do the right thing and not push people off an affordability cliff and extend these tax credits, which, again, in January of 2026, it's already playing out in real time for people in terms of trying to make really difficult, almost impossible decisions about whether or not to enroll in the programs and sort of lock themselves into monthly payments, which is going to force them to, again, make really impossible choices as far as other necessities for themselves and their families. Again, if you have any question about this measure, the Breaking the Gridlock Act, please do not hesitate to contact my office. I want to just end, though, by really thanking all the people who stepped forward during this whole ordeal, when again there was so much negativity and so much cynicism and skepticism about whether or not, with the opposition of the White House, the leadership of the U.S. House of Representatives, whether this thing was ever going to make its way or get anywhere. But the fact is that your voice was heard, and the institution of the U.S. House of Representatives did move forward and did act. We've still got more steps to go, but people really should at least take a moment and really recognize that your input, your care, and your concern made a difference. Thank you for listening.